Hi, good morning. My name is Jose Miranda. This video is the oxygen administration video for BSN 206-14. I'm in my Nightingale scrubs, got my badge. A few things that I wanted to point out. Got some supplies. I got my armor breather, my cannula, got my religious bracelet on. I have Mr. Miranda here. Not sitting quite well here, but we will make do with what we have. So first things first. Oh, and I also have a Christmas tree for just for supply purposes. So we'll go ahead and get started without further ado. So like I mentioned, my supplies are my mask, my nasal cannula. Oh, sorry, and my hand sanitizer here when I perform hand hygiene. Um, so once I gather my supplies, I would knock on the patient's door. Well, prior to me coming to the patient's door, I want to make sure I have everything that I need. I go ahead and gather everything up. Go ahead and go down to the patient's room, knock on the door. Um, Go ahead and perform hand hygiene almost instantly if possible. Introduce myself. Hi, my name is Jose. I'm one of the nurses here. Can I have you state your name, your date of birth, and medical record number if you know it? And then use patient's wristband to cross reference to make sure this is who we are here to see and indeed here to help. From there, I would explain to my patient what we are there to do. Hi, sir. Like I mentioned, my name is Jose. I'm one of the nurses here. I'm here to give you supplemental oxygen. Your oxygen needs are a little on the higher side, or uh, there's well, the doctor thinks you need some oxygen, and we really think this would help. So let me get everything out, and I will explain it. I will go ahead and explain everything for you, and I will open everything up. So at this point, I would go ahead and gather my nasal cannula first. Um, for this, at every possible step of the way, I want to make sure that my patient is comfortable with what I'm doing. I know placing the cannula, placing a patient on oxygen may be frightening as heck. Um, so I want to make sure that my patient feels comfortable. I want to make sure that my patient knows what I am doing at all times. I want to make sure the patient trusts me. So I wanted to explain this is a nasal cannula. I'm going to go ahead and open it. And it has a few components to it. I'm going to go ahead and describe the wrapping there. So my nasal cannula has my tubing on one end. It has a nasal portion on the other. It has two little prongs here. Uh, so the tubing would go around your ears. Each prong would go into each nostril, and we would go ahead and give you some oxygen uh, through the nasal cannula. Um, and go from there as such. Assuming my patient is comfortable and my patient knows that what I am doing, and they have agreed to the nasal cannula, I would go ahead and place the nasal cannula on them. So, sir, Mr. Miranda, I wanted to mention each side of the nasal cannula sits comfortably above your ear. There's a portion here that sits under your chin, and the prong goes into each nostril. And I wanted to mention that the back end of the tubing here would would be secured to the extension of the tubing that would essentially go to the wall mount, or the flow meter that has a Christmas tree connected to the end of it here. Um, and I want to make sure that it is hooked up to the oxygen green. So, Mr. Miranda, without further ado, I'm going to go ahead and place the nasal cannula on you. I'm going to go ahead and place the prongs into each nostril as best as I can, and then go ahead and place, if I need to, give myself some give here. Place the nasal cannula in the patient's nostrils, and then place each loop around the ear here. Like so. Go over to the other side without, causing the patient any discomfort. Try to make adjustments if necessary, and then place the cannula, the ear loop above, around the second portion of the ear here on this side. Once it is on, if I need to make any adjustments to secure the cannula, I can go ahead and pull this portion here, and make adjustments to make it tighter, make it looser. I want to make sure my patient is comfortable because, again, placing them on oxygen can be really, really scary. Um, and like I mentioned, I'm going to go ahead and secure this end of the tubing to my extension that would also feed into the flow meter. And I want to make sure it's hooked up to the green oxygen. Um, Based on what the doctor's orders are, I would go ahead and turn the dial up to the number that the doctor would state in the order. Now, typically for a nasal cannula, it can range from anywhere between 1 to 6 liters per minute. Um, I think that is the limitation for the nasal cannula itself, the 1 to 6 liters, or it is not that it's a limitation, but it is what is ideal. And I always additionally want to respect to what the doctor is asking me to do. So I would basically place the patient on what the doctor thinks is right, or pardon, not that they think it's right, but that is what the order states. Um, okay, Mr. Miranda. So I'm gonna go ahead and plug this into the wall. We're gonna go ahead and get you some oxygen. Okay. So it's on the Christmas tree. It's on the flow meter. We're getting Mr. Miranda some oxygen here. Uh, like I said, depending on what the doctor's order is, I would change the dial on the wall. Make sure it's hooked up to green. The oxygen is green. I want to make sure that the cannula is nice and centered. I want to make sure that the prong is in each nostril. I don't want one prong to be out, as it tends to happen at times. I want to make sure that it's nice and fitted for Mr. Miranda to be comfortable here. And then I would provide Mr. Miranda with some education as well. Mr. Miranda, I want this to be nice and snug on your face. I don't want it to be super tight. And the reason for that is when the nasal cannula is on super tight, it can cause some skin irritation and some breakdown. Okay, Mr. Miranda? I want it to be nice and snug to where, it's on comfortably, it's not falling off of your face, and you are comfortable with, wearing the nasal cannula and so on, right? Mr. Miranda, any questions for me? Perfect, no questions at all. All right, Mr. Miranda, I'm going to go ahead and move along from here then. Once I've ensured Mr. Miranda doesn't have any questions and is comfortable, I would go ahead and exit the room. Uh, for this scenario, though, I will not be exiting the room. Hey, Mr. Miranda, I'm back. So I'm continuing from where I left off. Mr. Miranda, it's me. It's Jose, your nurse again. Hey, so your oxygen is still a little low. So we need it to come up, and we need it to come up a little higher, right? We need your saturation to be up a little better. We're gonna try a different oxygen source. So we're gonna try a non-rebreather mask, and what it is essentially it's a mask that has a bag, which is a reservoir that contains the oxygen. So the mask itself has a strap and has a little metal portion on the top that where your nose sits, where the bridge of the nose sits. And it has the mask on the bottom, and the tubing connects to the wall just like the nasal cannula does. Um, so let me go ahead and break it out. I'll go ahead and then show you. But this allows for a higher, you know, flow of oxygen to be administered to you at any given point. So I want to make sure Mr. Miranda is comfortable. I don't want to scare him. I would go ahead and peel the nasal part in the non-rebreather out of the mask, discard my wrapping, and my paperwork here that comes with it. I would go ahead and show Mr. Miranda the mask itself. It has a strap, little metal piece here, Mr. Miranda, and then the bag, which is our reservoir. All right. The bag should lay comfortably on your chest like so. And then the mask should fit nice and snug, not very tight as well. So at this point, we're going to go ahead and remove the nasal cannula, and then we will go ahead and switch you over to the non-rebreather mask. So just like the nasal cannula, I will go ahead and I will work to disconnect the nasal cannula and connect it to the tubing to the secure source of oxygen, or the extension tubing that will then connect me to the flow meter of oxygen itself. Um, so at this point, I would go ahead and start removing my nasal cannula. Um, I would want to make sure that it is nice and prepped. If my patient here, Mr. Miranda, depends on the oxygen, I don't want to fumble it. I don't want to not be ready. I want to make sure that I am prepared. I want to make sure that I am ready. And I want to make sure that the transition from one to another is nice and smooth. Okay? So I'm going to go ahead and, Mr. Miranda, I'm going to go ahead and switch this off. Okay? I'm going to be removing the earlobe here, portion of the ear lobe here on the nasal cannula. I'm going to go ahead and remove the nasal cannula. And then I'm going to go ahead and disconnect the nasal cannula from my oxygen source. Okay, I will place that to the side. And I will try to make the transition as smooth as possible. Mr. Miranda, this is going to go around your head. Without causing Mr. Miranda, any pain or any damage. I'm going to go ahead and place the mask over your face. The bottom portion of the mask should sit comfortably on your chin. Sorry, the mannequin isn't really helping here. Make sure the mask fits nice and snug. Go ahead and pinch the bridge of the nose where the little metal clipping is. Once the non-breather mask is on Mr. Miranda and I am comfortable that he is comfortable, that it's on correctly, I will go ahead and, sorry. We don't want Mr. Miranda to fall over. We'll go ahead and connect the oxygen to my wall, my regulator, or my extension tubing. I want to make sure it's nice and tight and secure on there. And I want to make sure that it is connected to the green oxygen. I would go ahead and discard my nasal cannula. We don't need that anymore. Discard anything else that might be in the way. I want to make sure that the reservoir is nice and open. It's sitting comfortably on Mr. Miranda's chest. I want to make sure Mr. Miranda isn't panicking. Now, I say this because the mask itself can be a little, reason to panic. It could be uncomfortable. There's patients out there who are claustrophobic. I want to make sure that Mr. Miranda is comfortable. I want to make sure the strap is nice and tight around the back. I want to make sure he is comfortable. If I need to, I can pack the sides of the, well, first and foremost, the strap here, I made an adjustment, but it needs to sit above the ear, right? If I need to, I can place gauze in here to where it would protect the earlobe, or pardon, not the earlobe, but the top of the ear of the patient, in this case, Mr. Miranda, to protect the ear from any irritation. Now, the same rules apply. I want to make sure that it's nice and snug on the face. I don't want it to be I don't want it to be super tight. I want the oxygen to flow into Mr. Miranda, and I don't want there to be any skin breakdown or any irritation. At this point, if I need to make adjustments, like I mentioned, I would make adjustments. If it's too tight or too loose, I would either loosen the strap or tighten it up. I can place gauze here along the cheekbone to make sure that it's not irritating Mr. Miranda. I want Mr. Miranda to be as comfortable as possible. Again, the mask can be a little frightening. There's people out there who are claustrophobic, and I don't want Mr. Miranda to be uncomfortable. So, Mr. Miranda, how does this feel? Are you comfortable? Yeah? Okay. For, you know, as I mentioned before, there are gauze. I've seen, well, not that I've seen, but I would think that the gauze would be there for protection, or you can even, I think that it'd be an idea for a band-aid or, a bandage to be placed on the inside. Just anything that we can potentially do to get Mr. Miranda comfortable, right? And then with that, I want to assess every 2 hours for change in the oxygen, for change in any condition for Mr. Miranda, if there's any irritation, any breakdown. Um, and then every hour, I want to reevaluate the oxygen source, right? If there needs to be a decrease or an increase, it all would depend on what Mr. Miranda, not Mr. Miranda, it would all depend on what the doctor's ordering for Mr. Miranda. Now, with this non-rebreather, we can flow anywhere from, well, For the normal breather itself, it's 15 liters per minute on the normal breather. And then we want to make sure that the reservoir stays full at all times. Um, at any point, like I'm saying, we would reassess. We would, if changes needed to be made, we could make them at that time. Um, but it's all with the idea of getting Mr. Miranda comfortable. Um, and getting Mr. Miranda's saturation up. So if I need to make adjustments, if I need to pinch the bridge of the nose, if I need to, adjust the mask, the idea is to make sure Mr. Miranda is comfortable, right? So let Mr. Miranda be on the oxygen treatment, and we would go based on what the doctor was asking us to do. So I would exit the room. In this case, I will not be leaving. Hi, Mr. Miranda. I'm back. It's Jose, your nurse. So I just wanted to point out your oxygen has returned to normal. So we're going to be removing everything, okay? How does that sound? All right, Mr. Miranda, that sounds good to me. So we're going to be taking everything off. We're going to be removing the strap first. I'm going to hold on to the mask, and then I'm going to be removing the mask, okay? So as I'm walking through the process, at any given point, I want to make sure I'm talking to Mr. Miranda without scaring him. Don't want to frighten him. I want to make sure that we're explaining every step of the way. So I will start pulling everything off. I would start by removing the strap. Usually it's the most uncomfortable portion. And then I would pull away the mask. And then I would disconnect, turn the oxygen off, disconnect, and then get rid of the mask. So, as I mentioned before, this would be a good time to assess and see if the mask was on correctly, as it should have been. We would have noticed right immediately, but want to make sure that we did right by the patient. Um, if we needed to, the patient could have told us to, but we would look, uh, make sure there's no scarring on the bridge of the nose, make sure there's no any irritation to the cheeks, the top of the ears. Want to make sure, look at and assess Mr. Miranda's face to make sure everything's okay. Once I've disposed of everything, I'm all right. Well, once everything's disposed of and I'm all finished and done, I want to ask Mr. Miranda if he is comfortable in the position that he is. Right? We've already assessed the skin, and then we will go from there. Mr. Miranda is comfortable. Uh, Once I make sure everything's in the trash, I would go ahead and perform hand hygiene. I would leave the patient's room, document my results, and let the doctor know from there. But prior to me leaving, I want to make sure Mr. Miranda is comfortable. I want to make sure I've assessed the skin. If there's anything that needs to be attended to for possible irritation. Make sure Mr. Miranda is comfortable. I think I've said it 3 or 4 times, and I want to make sure he has the call out within reach in case he needs anything. He can get a hold of us. Like I said, I would perform hand hygiene, leave the patient's room, document my results, and then go from there. Thank you so much.